Welcome back to Full Circle with Mikali. A very good morning to you, where you're watching us from 111 444 111. That is our SMS line. It's going to cost you a shilling to be part of the conversation. Please send in your questions, because this next segment is one that we all need to be paying very close attention to. It is time for Advice Circle. We're talking about reproductive health and busting the myths around that. We've had so many things. There's so many words that are, and synonyms that are thrown our way, acronyms rather, that are thrown our way that we don't even understand what they mean. What do they stand for? Do I have that? Do I not have that? So we'll be looking into all of that, and having this conversation with us this morning is Dr. Tungani Mushiri. Welcome to the show.
Thank you very much, Mikali.
Nimesema titles vizuri ama there's more to it, and you can introduce yourself. This is your camera, Daktari.
Thank you. Hello everyone. My name is Dr. Tungani Mushiri. I am a consultant obstetrician gynecologist, and I am someone passionate about matters reproductive health, and that is why we are here, so that we can share what we know and hopefully debunk a few myths around the same.
And there are many, right?
Yes.
There's so many things that are said and they have no basis.
Yes.
Have you had people who are quoting the Bible and it wasn't a part of the Bible? It was just like a quote that was powerful from somewhere else. But mtu anakuja anasema Biblia inasema.
Yes.
So today we are just here to debunk all of those myths. But just before we start, reproductive health ni nini? Tuanzie hapo.
So generally, when you're talking about reproductive health, you're talking matters that surround reproduction. Okay, and this is a wide area, because we are talking about the things to do with conception, pregnancy, and general well-being, even beyond pregnancy, conception. We are talking about matters with fertility.
Yes.
We also talk about matters to do with sexual health, and even beyond that, we are talking about family planning.
Yes.
And issues to do with old age, menopause, and so on.
All of that is
Yes.
here today.
Yes.
And please send in your questions, 111 444 111. If you have any questions regarding reproductive health, that is our SMS line, because Daktari yuko hapa leo atajibu maswali yote. Let's start with fibroids.
Yes.
Because there's a lot that goes on with that area. And I'll just go with the very first myth, that fibroids is in relation to old age. And the reason we're seeing an upsurge when it comes to fibroids is because more and more women are settling or getting married or having children at an older or later age. Is this a myth? Is this a fact?
There is some element of truth to that.
Okay.
But even before we go to that, I think it's good for the viewer to understand what fibroids are.
Please.
And fibroids are benign or non-cancerous growths of the uterus, that is the womb. And they are mainly found in women in their reproductive age.
Okay.
That is in the years between 18 to 49.
Okay.
However, it's not uncommon also to find fibroids persisting past the age of reproduction. Now, we've heard that they are occurring more and more, and because
tukizeeka, we don't have children, then more and more women are getting, or there's an uprise of fibroids because of that.
Yes.
Is it true?
Now, like I said, there's some element of truth to that, because studies have shown that there are various risk factors, that is conditions that you have that can make you more prone to have fibroids. And one of the things that has been found is that not having children, or having children much later in life, can put you at higher risk. However, that should be taken with some caution, because not all women who will not have children will get fibroids, or not all women who will have children much later will get fibroids. And we've found women even who've had children much earlier getting fibroids. So there are still more factors that can make you at a higher risk of getting fibroids, other than just the age or the age at which you get your first child.
What are these factors, though? It would be interesting to know because, like you've mentioned, I also know people who've gotten children
Yes.
and gotten fibroids after.
Yes.
And I would like to think of people who've dedicated their lives to, be in the church, and they will never probably have children, and that's the journey they've chosen.
Yes.
Does that mean that it's a death sentence? Well, not really a death sentence, like a fibroid sentence to them because of what they've decided to live? What are those factors?
No. Age being one of them, and
Yes.
age at which you get your first child,
Uh-huh.
there are still more factors.
Okay.
And studies have shown that Africans, that is us, African women, have a higher risk of getting fibroids than others.
Okay.
Something else is the genetic makeup. If there is a family history. However, I need to say that, like most things in medicine, we still haven't fully understood, and there is no doctor who can tell you that for sure you will get fibroids or you won't get fibroids. So whatever lifestyle that you choose should not condemn you or
Yes.
make you think that I am definitely going to get fibroids.
Okay, so the next
Yes.
time you feel like you want to loosely throw that line around, be careful.
Yes.
Still on the same, when you get fibroids, does that mean that you cannot get pregnant?
No. Yes. What the viewer needs to understand is that a lot of women have fibroids and they have no symptoms. And most of the times, the fibroids will not cause any issue. What we have found is that what will determine how a person who has fibroids, is things like how many fibroids, how big are they, and where are they located.
Okay.
So a lot of times you'll not get any issues. Women will conceive, they will carry the pregnancy up to term, and they will deliver normally. But that is not to say that they may not cause problems with conception and pregnancy. Depending on the location and again the number and the size, you can get some problems with conception.
Okay.
In very rare cases, that is if they are blocking maybe the passage. Sometimes if they are located where the baby is supposed to attach, they may cause pregnancy losses.
Okay.
Yes.
Okay. So we'll move away from fibroids for a bit.
Okay.
Let's talk about PCOS.
Yes.
And what that is and what does it mean when we hear a lady say that I have PCOS.
Yes. This is another condition that is surrounded by myths and mystery.
A lot of it.
And thank you for giving me this opportunity to try and debunk a few of them.
Okay.
Now, when you talk about PCOS, it's a mouthful. We are talking about polycystic ovarian syndrome. And in medicine, when you talk about a syndrome, it tells you that this is something that is composed of more than one thing.
Okay.
But to put it briefly, is that it's a hormonal condition that affects women, mainly of reproductive age. And since it's a syndrome, there are a few components to it.
Okay.
One of them is already in the name, that is polycystic ovaries. The ovaries is where the eggs, the female eggs, come from, and the female hormones of reproduction. When we talk about polycystic, we are talking about cysts, many cysts, and cysts are fluid-filled spaces. So one of the components of PCOS is finding many fluid-filled spaces in the ovary. Now what this does is that it reduces the function of the ovary, and we know the function of the ovary is to make female eggs and to produce the reproductive hormones. Other than that, there are other components to this syndrome, and one of them is the hormonal aspect. We know that in the human body, there is a balance between male and female hormones.
Yes.
So in polycystic ovary syndrome, we find that that balance is upset. So you may find a woman may have more of the male hormones, and that can present in many ways in her body. She may get a beard, she may get pimples, that is acne, and so on and so forth. So that is the second component to this syndrome. And the third one is that the woman is unable to produce eggs as efficiently as before, which we call anovulation. So this will of course lead to problems like having issues with fertility. She's not able to conceive as she may want to, and also it may interfere with her menses. So it's a syndrome and there are components to it. There's much more to polycystic ovarian syndrome, because those three issues can lead to other issues. Top on the list is high blood sugar and high cholesterol. So the woman may get diabetes and risk of other conditions from that.
Wow.
Yes.
That is a lot. That is a lot. There's a myth, well, you'll tell us if it's a myth or a fact, that if your menstrual cycle is irregular, then you have PCOS. Is this true? For every irregular cycle that women have?
Well, let me put it this way.
Okay.
There are many causes of an irregular cycle. PCOS is one of them.
Ah, okay.
Yes. It is one of the common causes, but you should not assume now that my cycle is irregular that I have PCOS. There are other causes. Perhaps I can list a few.
Please.
Some of them is a change in weight, either too much weight loss or too much weight gain. It interferes with the hormonal component. Undernutrition or overnutrition, of course, will lead to that. Then we've found even sometimes psychological or physical stress leading to an irregularity of the menses. Then we have medical conditions also that can interfere with the hormones. For example, the thyroid, very common culprit in causing irregularity of hormones. And of course, if you have something that is interfering with the brain function, perhaps something growing in the brain because the signal comes from the brain. That's just some of the causes. Now, what we need to be very careful about is what you may call irregular, the doctor may not find as irregular.
Oh.
Because the definition may matter. Because, like for example, if your cycle is 26 days,
yes,
and maybe your menses came this month on 1st, so you will get them again on 26th. So you will get 2 cycles in a month.
Okay.
And the next month, of course, it will not come on the 26th or on the 1st. So somebody may be saying the cycle is irregular, but in the real sense, it's not an irregular cycle.
Okay.
And we have learned to take anything between 3 weeks to 5 weeks as a normal cycle. So a few variations do occur depending on your condition. So it's good to discuss what you think is an irregular cycle with your doctor.
Okay, great.
Yes.
When you talk about PCOS right there, what are some of the, I don't know to call them solutions, medications to just help with the irregularities of the hormones, to make sure that your periods are regular, and to just help even when you're trying to conceive?
Yes. So it's a syndrome. There are various presentations to it, and there's sort of like a spectrum to it, in that 2 women who have the condition may not present the same, and they may not get the same kind of severity, sort of to speak, of the disease. So when we are looking at how to approach it, we look at the person in totality. And one of the things is, how have they presented? Is their main problem their beard? There are some people who the cycle is not a problem to them.
Yes.
So some people, it's the beard that is the problem. So that is what you have to address as the doctor. There are some people, they want to conceive. Some people don't want to conceive. So when you look at it, you have to look at it in that totality. That being said, there are a few measures that we advise generally to women with polycystic ovarian syndrome. We have found that most of them have weight gain. So one of the components that we tell you is try and lose your weight.
Mm-hmm.
Others include checking on your blood sugar.
Okay.
We've had that blood sugar goes high.
Yeah. So regulate that.
Yes.
Okay.
Then basically just a healthy lifestyle.
Okay.
Yes.
Okay. That among many others,
Many.
depending on what is projecting when you have PCOS or what
Yes.
you really want to work on. Please send in your questions because Dr. Ari will be here to answer them. I see them flowing in, so we'll get to them after this very short commercial break. Don't go too far. Welcome back to Full Circle with Mikali. A very good morning to you. We are taking all your questions on matters reproductive health. 111-444-111. That is our SMS line, and it's just going to cost you a shilling for you to send that in. Dr. Tungani is here to answer all of your questions. So, are you ready? I have a few here that just came in. Hi, Mikali. Always enjoying the show. Thank you. What happens when UTI is untreated? Watching from Ongate Rongai Kiserian.
Okay. Now, UTI is a urinary tract infection. That is an infection of your urinary system.
Yes.
And that starts all the way from your kidneys to the tubes that connect to the bladder and the one that lets out the urine. So that's a sensitive area to get an infection. And they are common. UTIs are common, especially more in women.
Mm-hmm.
And it's always advisable that they are treated because you've had the organs affected. One of them is the kidneys.
Yeah.
So if you don't treat, you might get kidney disease, and you only have 2 of those. So it's not advisable not to be treated.
Okay.
Yes.
So we have another myth where the UTI, people think that the UTI is very common and strictly just occurs in women.
Mm-hmm.
Is that a truth? Is it a myth?
No, that is a myth.
Yes.
Women do get UTIs more commonly because of 2 things. The anatomy of their body. Secondly, because of pregnancy.
Mm-hmm.
Pregnancy puts women more at risk of UTIs. That being said, does not mean that men don't get UTIs. I guess what is more confusing is that for men, the line between a UTI and a sexually transmitted infection is a bit less clear. Okay. But men do get UTIs.
Okay.
Yes.
There's something about yogurt and women taking that to help with the UTIs. Is that a truth? Is it a myth?
There is quite some truth to that assertion.
Yes.
And it is known that natural yogurt, unsweetened yogurt, has what we call probiotics. And these are natural bacteria that are necessary for the female body, in that they help keep the amount of yeast colonization in check.
Okay.
So natural yogurt does help in preventing yeast infections in women.
Okay.
Yes.
Great. Morning, Mikali and Daktari. Having a bloated lower abdomen and not pregnant. Daktari, what might be wrong?
Now, there are many problems that can be attributed to that.
Yes.
And I think it would be very hard to
know what it is and then go see a doctor.
It's advisable that you see a doctor.
Okay.
Because what you may be thinking is a small issue
could be a bigger issue.
Yes.
Okay. Hi, Mikali. Is it true that prolonged use of P2 in your 20s will hinder? I like how you specify 20s. In your 20s will hinder you from getting a baby in future when you will be married. My name is Phoebe from Katse.
There are many issues associated with that.
Yes.
And just top of my list is that probably if you find yourself using P2 too much,
and not just P2, I mean all emergency
contraception, then it means you'll need to look for a more permanent method. And You probably also may want to worry about the other issues associated with unprotected sex. It's not advised that you use the emergency contraceptive many times in a year.
Okay.
There are other issues associated with that. Fertility, not top on my list.
Okay.
Yes.
Okay. Thank you for clarifying that. Mikali, I'm Carol from Embu. Ask Daktari, what can I do to get pregnant fast? Because before I lost 3-month pregnancy, and from that time, sija conceived tena. Please advise. So they've gotten pregnant before, lost the pregnancy at 3 months, and they're wondering what to do to get pregnant again.
No, very unfortunate to hear that. Sorry to them. There might be more history we may want to get from that, so that we can know maybe why she lost the pregnancy, and I don't think we have that information. We also don't know how long she has tried before she has said it's too long. But generally speaking, if you want to get pregnant, the first thing is when you've had a miscarriage, consult a doctor so that you can explore the issues around it. There is some medication you may want to take, what we call preconception care. We may want to look for some diseases that may harm your pregnancy. Other than that, timing is very important. You have to know your cycle so that you know your safe days and you know when you are ovulating and hence more likely to conceive.
Okay.
Yes.
Okay. Where are we? Hi, Mikalina Daktari. Please ask Daktari, I'm a mother of 3 girls and have been told that my uterus is small. Can I conceive again?
All right. I don't think the uterus being small could be an issue. If she has conceived before,
Yes, 3 girls.
it means the uterus is able to grow in size. The uterus is a very dynamic organ. I mean, it comes from a spare-sized organ to one that can carry a 3-4 kg baby.
Yes.
So it's able to expand and shrink back. So I don't think she has an issue. If she has been able to carry 3 babies, she should be able to carry another baby.
Okay.
Yes.
Okay. Hello, Daktari. My name is Milka. I'm 16 weeks pregnant, and my doctor confirmed that I have placenta previa. I hope I'm saying that right. What am I supposed to do? Please help. Should I attend a gynecologist clinic?
Yes. To answer Milka, I would like to first clarify what is placenta previa.
Yes, please. I've never heard of it before.
Yes. This is a condition in pregnancy where the placenta is low. The placenta is not supposed to be near the outlet.
I was about to ask where it's supposed to be.
It's not supposed to be near the birth canal.
Okay.
Because that is the opening, and the placenta is supposed to attach somewhere where there is good blood supply, and it has very little chances of detaching before the pregnancy is done. So when it attaches in the lower segment, that is near the birth canal, there is a chance that it can separate and bleeding can start even before labor.
Okay.
So that is a risk. However, to allay Milka's fear, I understand her anxiety, but I would like to allay her fears in that you can still carry a pregnancy to term with placenta previa with proper follow-up. The second thing is that 16 weeks is quite early.
Yeah.
And despite there being more risk to this pregnancy, there are very high chances that the placenta will migrate.
Okay.
What we call migration, and go to the right place.
Okay. So there's hope.
Yes. So what she needs is to have follow-up. She needs to see a gynecologist and to have regular checking of the placenta with an ultrasound, and she'll be fine.
Okay. Milka, there's hope there. Hello, Mikali. Kindly ask his view on a person who had surgery to remove fibroids while a few weeks pregnant, and she did not know that she was pregnant. Now in the 6th month. Jane.
Okay.
Okay.
Yes, I understand Jane's concern. It's sometimes the things do happen. You get pregnant, you are not aware, and probably even the doctor who took her to surgery was not aware. or even sometimes surgery is done in pregnancy.
It is possible for that to happen.
Yes. If the symptoms are too much,
Okay.
we sometimes take the life of the mother. We consider the life of the mother. So you can't get surgery in pregnancy. We try to defy it as much as possible, and especially surgery that is involving the uterus, because in pregnancy the blood supply is very rich and the likelihood of bleeding is very high. However, we are very grateful that she went through the surgery and it was successful.
Yeah.
Now, what I would advise is that if she's making a delivery plan, she needs to involve the doctor who did the surgery, because he knows the extent of the surgery that was done. But we do consider somebody who has gone through the surgery for fibroids, we call it a myomectomy, as somebody who has a scarred uterus. There is already a scar that was put. So most of the time we'll consider that as somebody who has gone through a cesarean section. So the same precautions we take for someone who had a previous cesarean section are the same that we'll take for a person who has gone for a myomectomy.
Okay.
So she needs to see her doctor. If she's seeing a new doctor, then she needs to carry over that history to the new doctor. But she should not panic. If the pregnancy is already 6 months, well and good.
Yeah.
She's headed the right way.
Great.
Yes.
Hello, Mikali na Daktari. My question is, my period lasts up to more than 40 days before they appear again. Could I be having any problem? 40 days.
Well, 40 sounds a bit long, and it could be that there might be an issue. It might be not an issue. Like I said, there's so many causes of why periods may prolong. Okay. And some of it is just the psychological and diet. Yes, probably exercise. So there is more to it. She should not panic. Just needs to explore a bit more of the history.
Okay.
Yes.
Okay. Hello, I had a depot ile at 3 months. And it expired on 12th July. Since then, I've been sporting up to date. What might be the problem?
Okay. Depot, I assume she's talking about Depo-Provera. It's a method of contraception. It's only a 3-monthly injection.
Okay.
It's a hormone. Now, what it does is that it interferes with the body's hormones. So once it's in the body, it might interfere with your cycle. And sometimes it takes even a bit longer to leave the body. So the body takes time to readjust back to its normal interplay of hormones.
Okay.
So that can happen. And sometimes when it's too much, it's disturbing your lifestyle, we can put you on medication.
Okay.
Yes.
Okay. Asante. I got my periods. Daisy from Kirinyaga. Daktari, kama Femiplan pills uliza daktari kama Femiplan pills inaongezanga mtu weight, and if yes, naeza fanya nini?
Okay. Now Femiplan are the oral contraceptives, the daily contraceptives.
Yes.
One of the side effects associated with the oral contraceptives is weight gain. Of course, there are many things you can do if you don't want to leave the method. You can adjust your diet, you can adjust your lifestyle to cater for the same. But yes, you can gain. Some people do gain weight with the Femiplan method.
Okay.
Yes,
okay.
Not all.
Not all.
Yes.
Our time is really running out. Let's try and see if we can answer one more. Hi, Mikali. I just lost a baby a month ago after being born in breech, and also had excess amniotic fluid. In the next pregnancy, will the two complications happen again?
No.
The breech and excess amniotic fluid.
Sorry for that. We cannot give a straight answer. What I can say is that excess amniotic fluid can make the baby present abnormally.
Yeah.
Because the baby is able to move a bit more. Many causes of excess amniotic fluid. Some of them serious, some of them not. Probably the best thing would be to have a doctor sit down before your next pregnancy and explore the same, most likely the condition may not recur.
Okay.
Yes.
One final question.
Yes.
Hi, Mikali. I feel some pain when I go for a short call. Could I be having any problem, Daktari?
It's not normal to feel pain when going for a short call.
Mm-hmm.
And top of my list would be a UTI.
Yeah.
So need to consult on the same.
Okay. Do I have time for just one more? One more, thank you. Can one get pregnant after an X-lap? After an X-lap to remove polycysts? I had the surgery in December. After how long should I wait?
Yes, yes, you can get pregnant. How long you should wait? Best advised by the doctor who did the surgery. But most of the time, 3 months is usually enough time for healing.
Okay.
But again, caution, because I was not part of the operation.
Okay.
Yes.
Our time is up, and you have so many questions here. But thank you so much. You tackled as many questions as you could. How can people get directly in touch with you, Dr.
Thank you very much. I do consult for Equity Afya. We have excellent clinics at Ruiro, Kamakis, and Juja. The clinic number is 0765 00 0046. Or if you want to reach me personally, my phone number is 0780 477 862, or on social media, Tungani Mushiri, that is YouTube, Facebook, and Instagram.
Absolutely. Thank you so much, Dr.
Okay.
We highly appreciate this.
Okay.
Looking forward to have another session with you.
Thank you, Mikali.
And on that note, we're going to take a very short commercial break. We will be right back. Don't go too far. This is Full Circle with Mikali.